important causes of infectious diseases are bacteria, fungi, virus, and other parasites, which result in death, disability, social and economic disruption of millions of people around the world. Despite safe and effective interventions, there are people who lack access to the basic necessary resources, basic necessary preventions, methods, and treatments. Mostly, the developing countries are the biggest sufferers of infectious diseases. Here, co-infection is a very common phenomenon. The adverse effects of infectious diseases are found mainly in village communities, where they have no or very limited access to the basic healthcare resources.
Infection, as everybody knows, it is the entry of some microorganism into the body of human being, maybe any animal or any organism. But however, we shall speak here about human beings. Infection is the entry of any microorganism into a human being's body, and the disease, dis-ease, that does mean whenever this causes disturbance in the ease of the person. That means the person starts producing symptoms. This is disease. So infectious diseases are because of the infection through the microorganisms, and microorganisms do not directly come to be in contact with the body, but there are certain modes of transmission. We know air is the best mode of transmission for various microorganisms. The second mode of transmission may be water. The third mode of transmission may be vectors. It may be mosquitoes, it may be something else, some other insects. Similarly, we have mechanical transmission and other transmissions.
Approximately 14 to 16 million people die every year due to infectious diseases, out of which children are most vulnerable. Pneumonia, diarrhea, and malaria are the main causes of death amongst the children below the age group of 5 years. Cerebral malaria can cause permanent mental damage. Even the adults get affected due to infectious diseases. Mental disability, reduced quality of life, decreased productivity, is the key in stopping the spread of infectious diseases. It can play a major role between life and death. The basic hand washing approach can play a major role in stopping the spread of the infectious diseases. Unfortunately, improper and infrequent hand washing techniques are the major reasons for the spread of the diseases. The various ways of the prevention are
Hand washing.
at home or work. Wash your hands at frequent intervals and properly. Use a warm water preferably. The kids receive vaccination at a very early age, whereas the adults should stay up to date with it. The adults who have never had chickenpox or measles in their childhood are more prone to the diseases, as they have never been vaccinated against the same disease. Childhood problems like mumps, chickenpox, and measles are the main causes of effect of waterborne diarrheal diseases are found mainly in children of the developing countries. According to a report of the World Health Organization, the waterborne diseases account to 4.1% of the total global amount of diseases, and around 1.8 million people
The very first disease, influenza. Influenza is caused by human influenza viruses. Though the strain of the viruses, it is said that it changes its variety every year, and hence no vaccine has been yet very successful against influenza. We know influenza is a very mild disease. It sometimes may turn into a hazardous thing or in an epidemic, but however it is quite mild to human beings. It raises the temperature by 99 degree Fahrenheit till 101 degree Fahrenheit. The person has sneezing, cold and cough, and this person suffers like having a upper respiratory infection, but actually it is not the infection, it is the viral, and usually viruses are self-limiting diseases, so most of the care and cure is not required, most of the medicines are not required. But if a person is very cautious about knowing that this is an airborne infection and air can induce any sort of infection into the body, the person will be very conscious about the air. Whenever there are ups and downs of the temperature, wherever we know that it is endemic in particular area. Endemic means it is spread in a particular area, and this particular area is getting many patients of the same disease. If we know that this is endemic in a particular area, in that condition the people may wear masks, people may care for their own breathing, people may care for the droplet infections so that it is not spread through cough or sneeze of some infected person into a healthy person. So these are the preventive measures that the person should take. Most of the slogan of prevention is better than cure. We do understand that we should prevent rather than having the disease and then going to treat it. The waterborne diseases are preventable. If we have potable, safe drinking water, if we use the water which is at least safe for bathing, safe for cooking, safe for washing, and a safe water, a clean water, this naturally will prevent all the diseases that we think are waterborne. Let's start with our home. Within our home, if we have very good, a very clean water with which we are washing the hands, let us not wash our hands with soap and water even. But if the clean water washes the hands, it shall clean them. And this cleansing is highly required for preventing all the waterborne diseases at the first glance. using the water in a hygienic manner in our home, having the clean utensils, handling the water cleanly, having all the reservoirs of the water, of the drinking water covered, having our bathing water separate, having our toilet water different, and having a particular understanding of the clean water, the cleanliness. This helps us prevent the waterborne diseases at our home. Coming to the community level, the first thing that we see is well. Wells usually are open wells in which filthy things are falling down into the water, and this water is getting contaminated. We should have covered wells, first thing. Second thing, washing, bathing and such other activities near the wells should be avoided. Wherever we have bore wells, the underground water is getting used. Near the boring, we should never use the bathing and washing activity, so that it contaminates the ground and the groundwater. When we speak about the lakes and ponds, it has got stagnant water. This stagnant water may also get contaminated, and since they are open, naturally contamination is known. If we allow the animals to go into the lakes and ponds, naturally the contamination level will be more. But if we prevent the animals from getting into the ponds and lakes, if we prevent human beings to go and wash and clean there, if we prevent any sort of effluent, any sort of sewage, sludge, any sort of filthy material to go and fall into the ponds and lakes, the ponds and lakes will be clean. They shall give fresh water, they shall give clean water which can be filtered and used naturally. But we know that only the filtered water won't do, because we have a population explosion seen even today in India. In this condition, what we should do is periodically get the water checked. That what is the carry home message for our students, keeping in view the future of the hospital industry in the next few years?
No, the hospital industry, the future of our health managers or health administrator is very, very bright. It's still a very young and a new field, and it's a very, very exciting field. I encourage all our youngsters to join this, because you know, our Indian philosophy is Seva Parmo Dharma, and there is nothing better than any services besides providing succor to the ailing humanity. So the future is very, very bright. Of course, it is a very, very labor intensive industry, and you have to be very, very patient. You have to learn a lot of qualities, because you know, if you are in a good state of mind, you can forget and forgive so many things. But when you are in pain, every small mistake on any part hurts a patient, hurts sentiments of the family. So I will again say that future is very, very bright, and it is well worth a career to pursue.
So many thanks, sir.
Thank you so much, sir.
With the message of dedication, with the message of commitment and a very bright future for the hospital administration students, we conclude this session. Thank you so much, sir.
Thank you so much.